Hello, welcome to our channel. Today we're going to talk about a very important topic, the 12 warning signs of stroke in women that you should not ignore. Thank you for being here, and if you haven't subscribed yet, please do so. This helps us reach more people who need this vital information. The signs we will cover today include sudden weakness, confusion, difficulty speaking, vision problems, and more. Unfortunately, women are more susceptible to some of these symptoms due to specific factors that we will discuss throughout the video. So, stay with us until the end, and let's learn together how to identify these critical signs. Please subscribe and click like. Help our channel bring this information to more people who need it. Sudden weakness. Let's start with one of the most common and often ignored signs, sudden weakness. Sudden weakness is one of the most alarming signs of a stroke, especially when it affects one side of the body. Imagine walking calmly and suddenly feeling that one side of your body has become heavy, almost as if it had turned to stone. This sensation can be an indication of an imminent stroke. This symptom is often the result of an interruption in blood flow to the brain, preventing the muscles from receiving the necessary nerve signals to function correctly. Studies indicate that women are more likely to report sudden weakness compared to men, possibly due to hormonal differences that affect blood circulation. Research from the American Heart Association shows that women tend to underestimate the severity of this symptom, often attributing it to fatigue or muscle tension. This delay in seeking medical help can be fatal, making it crucial to recognize this sign immediately. Furthermore, hormonal factors can influence women's vulnerability to this weakness. For example, during pregnancy, the risk of stroke can increase due to changes in blood coagulation and blood pressure. This condition makes constant monitoring of women's cardiovascular health essential, especially during critical phases of life. To detect this weakness at home, you can perform a simple test. Raise both arms simultaneously, with the palms facing up, and hold them at shoulder height for 10 seconds. If one of the arms begins to fall, or you feel significant weakness on one side, this may indicate a stroke. Studies conducted by the University of Oxford show that this arm lift test has a 72% accuracy rate in detecting stroke-related weakness. However, it is essential to consult a doctor for a precise diagnosis. Difficulty speaking. Difficulty speaking, or aphasia, is one of the most characteristic signs of a stroke. Imagine trying to speak and your words turn into an incomprehensible puzzle. This symptom occurs when the stroke affects the areas of the brain responsible for language, making it difficult to form coherent words or sentences. Studies show that women are less likely to recognize aphasia as a stroke symptom. Research from Stroke Research and Treatment indicates that while 60% of men seek immediate help when experiencing difficulty speaking, only 40% of women do the same. This is partly due to the tendency of women to attribute the symptom to fatigue or stress. A simple test that can be done at home is to repeat a short and common phrase, such as, "Curtains are blue." If there is difficulty pronouncing the words correctly, or if the words come out jumbled, this may be a sign of aphasia. Studies from Stanford University indicate that this speech test has a 75% accuracy rate in detecting stroke-related difficulty. Again, it is crucial to seek medical guidance for a complete evaluation. Vision problems. Vision problems are a significant sign of a possible stroke. Imagine that your vision, usually clear and precise, suddenly becomes blurry, or you lose vision in one eye. This symptom can be frightening and is a strong indication that something is wrong in the brain. According to a study published in the Journal of Ophthalmology, women are more susceptible to stroke-related vision problems. The study followed 1,500 women and found that those with migraines had a significantly higher risk of experiencing vision loss during a stroke. This occurs because migraines can cause temporary changes in cerebral blood flow, increasing the risk of stroke. To test vision at home, you can cover one eye and try to read text at a standard distance. Repeat the process with the other eye. If you notice vision loss or double vision in one of the eyes, this may be a warning sign. Research from the University of Cambridge reveals that these vision tests have a 70% accuracy rate in detecting stroke-related problems. A medical consultation is indispensable for an accurate diagnosis. Sudden and intense headache. A sudden and intense headache, often described as the worst headache of your life, is a clear sign of a possible hemorrhagic stroke. Imagine a silent thunder exploding inside your head, causing overwhelming pain. This type of pain occurs when a blood vessel in the brain bursts, leading to internal bleeding. Research indicates that women are more likely to experience this type of headache due to hormonal factors. A study from the British Medical Journal followed 1,800 patients and found that women had a 25% higher risk of experiencing sudden and intense headaches during a stroke. This difference is partly attributed to hormonal fluctuations that can affect blood pressure. If you experience a sudden and intense headache, a simple test is to evaluate whether the pain is accompanied by other symptoms, such as blurry vision, nausea, or vomiting. Research from Johns Hopkins University shows that a combination of these symptoms has a 78% accuracy rate in identifying hemorrhagic strokes. Immediate medical intervention is vital. Loss of balance. Loss of balance is a common stroke symptom, especially in women. Imagine walking on a tightrope and suddenly losing all sense of balance. This symptom can occur due to the interruption of blood flow to the areas of the brain that control balance and coordination. A study published in the Journal of Stroke and Cerebrovascular Diseases revealed that women are more likely to experience loss of balance during a stroke. The study analyzed 1,200 stroke cases and found that 70% of women reported balance problems, compared to 55% of men. This suggests that differences in brain structure may make women more vulnerable to this symptom. To test balance at home, stand up and close your eyes for 10 seconds. If you feel dizzy or start to sway, this may be a warning sign. Research from Yale University indicates that this balance test has a 65% accuracy rate in detecting stroke-related problems. Always consult a doctor for a thorough evaluation. Nausea and vomiting. Nausea and vomiting are symptoms that can be easily overlooked as signs of a stroke. Imagine feeling suddenly nauseous with a sensation of malaise that doesn't go away. These symptoms can occur when the stroke affects areas of the brain that control the digestive system. A study from the American Stroke Association revealed that women are more likely to report nausea and vomiting during a stroke. The research, which included 2,500 participants, showed that 65% of women experience these symptoms, compared to 50% of men. This difference may be linked to hormonal factors and the functioning of the nervous system. To evaluate these symptoms, pay attention to whether nausea and vomiting are accompanied by other signs of stroke, such as intense headache or loss of balance. Studies from the University of Michigan indicate that the combination of these symptoms has a 70% accuracy rate in identifying strokes. However, only a healthcare professional can provide an adequate diagnosis. Difficulty walking. Difficulty walking is another important sign of stroke. Imagine your feet turning to lead, heavy and difficult to move. This symptom can occur due to the interruption of blood flow to the areas of the brain that control movement and coordination. Research shows that women are more likely to experience difficulties walking during a stroke. A study published in the Journal of Women's Health followed 200 stroke cases and found that 68% of women reported mobility problems, compared to 52% of men. This difference may be related to differences in the structure and functioning of the nervous system between genders. To test mobility at home, try walking in a straight line, placing one foot directly in front of the other, as if walking on an imaginary line. If you find it difficult to maintain balance or deviate from the line, this may be a warning sign. Research from the University of Pittsburgh indicates that this test has a 67% accuracy rate in detecting mobility problems related to stroke. Consult a doctor for evaluation and guidance. Tingling or numbness. Tingling or numbness, especially on one side of the body, is a classic sign of a stroke. Imagine the sensation of a million tiny needles pricking your skin, or the complete loss of sensation in an arm or leg. These symptoms can occur when the blood flow to the brain is interrupted, affecting the nerves that control sensation. Studies indicate that women are more likely to experience tingling or numbness as signs of a stroke. Research from the American Journal of Medicine revealed that 62% of women reported these symptoms, compared to 47% of men. This difference may be linked to hormonal factors that influence blood circulation and nerve health. To test sensitivity at home, use a soft-touch object, such as a feather, and pass it over the skin on both sides of the body. If you notice a significant difference in sensation between one side and the other, this may be a warning sign. Research from the University of Washington indicates that this sensitivity test has a 65% accuracy rate in detecting stroke-related problems. Medical confirmation is essential. Extreme fatigue. Extreme fatigue is an often underestimated sign of stroke. Imagine feeling so exhausted that you can't get out of bed, even after a night's sleep. This symptom can occur when the stroke affects areas of the brain responsible for energy and alertness. A study published in the Journal of Clinical Neurology showed that women are more likely to report extreme fatigue as a stroke symptom. The research, which followed 1,800 patients, revealed that 70% of women experienced extreme fatigue, compared to 55% of men. This difference may be related to hormonal differences and the impact of the stroke on the central nervous system. To evaluate fatigue, try performing simple activities, such as climbing a flight of stairs or walking for a few minutes. If you feel extreme exhaustion disproportionate to the activity performed, this may be a warning sign. Studies from the University of Toronto indicate that extreme fatigue associated with other medical conditions can have a 62% accuracy rate in detecting stroke. Seek medical guidance for a complete diagnosis. Facial drooping or asymmetrical smile. Facial drooping or an asymmetrical smile is a visible sign of stroke that can be easily detected. Imagine trying to smile and noticing that one side of your mouth doesn't move. This symptom occurs when the stroke affects the facial nerves, causing weakness or paralysis on one side of the face. Studies indicate that facial drooping is a common symptom in ischemic and hemorrhagic strokes. Research published in the Journal of Stroke and Cerebrovascular Diseases showed that 65% of women who suffered a stroke presented some degree of facial asymmetry. This symptom is particularly important for a quick and accurate diagnosis. To test this at home, ask the person to smile and observe if both sides of the mouth elevate equally. If one side remains drooped or appears weaker, this may be a sign of stroke. Studies from the University of Manchester indicate that this visual test has an 80% accuracy rate in detecting stroke-related facial paralysis. However, medical confirmation is essential for a complete diagnosis and timely treatment. Forgetfulness and memory loss. Forgetfulness and memory loss are lesser known but equally important signs of a stroke. Imagine not being able to remember simple things from daily life, such as where you left your keys or the name of an acquaintance. These symptoms occur when the stroke affects areas of the brain responsible for memory and cognition. Research indicates that women are more likely to report memory problems after a stroke. A study from the University of Wisconsin followed 1,500 women and found that 60% of them experienced some degree of memory loss after a stroke event. This impact on memory can range from mild to severe, depending on the area of the brain affected. To test memory at home, try remembering a list of words or objects after a few minutes. If there is significant difficulty in remembering, this may be a warning sign. Studies from the University of Cambridge indicate that memory tests have a 68% accuracy rate in detecting cognitive deficits related to stroke. Consultation with a healthcare professional is essential for a complete diagnosis and treatment planning. Why are women more susceptible to some of these symptoms? Research indicates that factors such as pregnancy, the use of hormonal contraceptives, and menopause can increase the risk of stroke. Additionally, conditions like high blood pressure, diabetes, and migraines, which are more common in women, also contribute to this increased risk. According to the American Heart Association, the United States has one of the highest stroke incidence rates in the world, especially among women. This is due to a combination of factors such as lifestyle, diet, and the prevalence of chronic health conditions. On the other hand, Japan has one of the lowest stroke rates, attributed to a diet rich in fish, vegetables, and low in saturated fats, as well as an efficient healthcare system that promotes prevention and early treatment. It is crucial to understand these signs and why they are important. Stroke is a medical condition that can have devastating consequences. With proper knowledge, it is possible to significantly reduce the risks. Sudden confusion. Sudden confusion is another sign of stroke that should not be ignored. Imagine a clear summer day suddenly turning into a dense fog, obscuring your thoughts and making it difficult to understand even the simplest things. This symptom can be devastating and is often confused with other conditions, such as stress or fatigue. A study published in the Journal of Neurology revealed that women are more likely to report episodes of sudden confusion during a stroke. This study, which followed 2,000 patients over 5 years, highlighted that many women delayed seeking medical help, interpreting the confusion as a consequence of a busy day or lack of sleep. To test mental clarity at home, you can ask yourself or a loved one simple questions like, "What is the date today?" Or, "Who is the current president?" If there is difficulty answering or an incoherent response, this could be a warning sign. Research from Harvard University shows that temporal orientation tests have a 68% accuracy rate in identifying stroke-related mental confusion. However, confirmation and medical treatment are essential. Adoption of healthy habits. Adopting healthy habits is one of the best ways to prevent strokes. This includes a combination of a balanced diet, regular exercise, stress management, and health monitoring. Imagine your health as a garden that needs constant care and watering to flourish. To prevent strokes, it is essential to pay attention to your diet. Some foods can significantly increase the risk of cardiovascular problems that can lead to strokes. Among the main culprits are foods rich in saturated and trans fats, sodium, and refined sugars. Studies show that adopting a healthy lifestyle can significantly reduce the risk of stroke. Research from Harvard University, which followed 5,000 people over 20 years, revealed that those who maintained a healthy diet, exercised regularly, and avoided smoking had a 60% lower risk of stroke. This study emphasizes the importance of small daily changes that can have a lasting impact on health. Additionally, controlling blood pressure, cholesterol, and blood sugar levels is crucial. Regular doctor visits for routine checkups can help detect and control these risk factors before they cause major problems. The combination of a balanced diet, exercise, and preventive medical care creates a solid foundation for a long and healthy life. This concludes our video. Thank you for joining us. I hope this information is helpful to you and your loved one. Please subscribe to the channel, click like, and share this video, as it will help spread this vital message to more people. And don't forget to check out our next video on the nocturnal signs of diabetes that should not be ignored. Until next time, take care.
Thanks for watching. We love that you're joining us. Subscribe, explore our channel, watch more videos, and embark on your journey to wellness with HealthToday.